When you think about businesses that are selling through the roof, like Skims or Allbirds, sure, you think about a great product, a cool brand, and great marketing. But an often overlooked secret is actually the businesses behind the business, making selling and for shoppers buying simple. For millions of businesses, that business is Shopify. It's home of Shop Pay, the #1 checkout in the world. You can use it to boost conversions up to 50%, meaning way less carts going abandoned and way more sales going through to checkout. Upgrade your business and get the same checkout Allbirds uses. Sign up for your $1 per month trial period at shopify.com/income, all lowercase. Go to shopify.com/income to upgrade your selling today. Shopify.com/income.
Hi everyone, I'm Deb Flashenberg. Welcome to Yoga, Birth, Babies, a podcast produced by Prenatal Yoga Center. We will be diving into everything prenatal yoga, birth, and baby related, hoping to inspire, educate, and empower you through your journey into motherhood. Thank you for listening.
Hi, I'm Deb Flashenberg, and I'm your host of Yoga Birth Babies. And today we're going to talk about vaccines during pregnancy and infancy and what parents should know. So the reason I thought we should do this topic today was because a few months prior to recording this podcast episode, there were new guidelines introduced for vaccinations during pregnancy and the newborn stage. And there was some new conflicting information. And from what I was hearing at the studio, people had questions and conversations about this. So whenever I hear some mumbling in class about what questions to ask care providers, what the new recommendations are, or anything that is just leaving parents feeling insecure in their choices and wondering how to make informed choices, I always think that is a topic to lean into. So I did some research and I found Dr. Flor Muñoz. Let me tell you a little bit about her. She's an associate professor of pediatrics and infectious disease at Baylor College of Medicine and Texas Children's Hospital in Houston. She's a physician scientist whose research focuses on vaccine safety and effectiveness in pregnant people, infants, children, and immunocompromised populations. And her work also addresses respiratory infections such as RSV, influenza, COVID-19, and pertussis. So I wanted to approach this from an evidence-based place, and I knew that Dr. Muñoz was going to help with that. So in this conversation, we break down what parents in the early part of pregnancy should start to think about when it comes to vaccinations that are recommended. And we also go to the why behind it. We also talk about why vaccinations can protect a newborn in those early weeks before they receive their own vaccinations. We also approach things that I hear a lot of parents ask. Are these vaccines safe during pregnancy? And then we also talk about some common misconceptions that you may hear, as well as conflicting information online, as well as looking to have resources and information that are trustworthy. So if you are pregnant or you have a newborn and you're feeling unsure which direction to go to and you want to have evidence-based information, I think this podcast is going to help reassure you and give you some answers and point you in the direction of how to have an informed conversation with your care provider so you can make choices that's best for you and your family. Now, before we get to that conversation, I always love to give the updates about what's happening at Prenatal Yoga Center. Really, the best way to keep up on our schedule for our in-studio, online, and on-demand classes would be our website, prenatalyogacenter.com. There you can find our full schedule, our workshop schedule, our blog, our past podcasts, even information on our teacher training. So take some time. It's a very big website. We have hundreds of pages because I've done blogs and podcasts for well over 10 years. So there's a lot of good, juicy information that you can dive into. And then hopefully I'll see you on the mat in class. The last thing I want to say, actually, there's two more things. A thank you to those who listen and support the podcast. And so would you please leave a rating and review so more people can find us and we can grow our community. I know it sounds silly, but those ratings and reviews really do help. And then I also want to thank you because people that listen to the podcast many times reach out to either be a guest or share an idea. And I love hearing it. Not only does it give me a sense of what you want to hear as a community, but it can introduce me to people that I may not have found on my own. So thank you for that effort. That is enough for me. We're going to take a super quick break. When we come back, we're going to talk vaccinations.
Girl, winter is so last season. And now spring's got you looking at pictures of tank tops with hungry eyes. Your algorithm is feeding you cutoffs. You're thirsty for the sun on your shoulders. That perfect hang on the patio sundress. Those sandals you can wear all day and all night. And you've had enough of shopping from your couch. Done hoping it looks anything like the picture when you tear open that envelope? It's time for a little in-person spring treat. It's time for a trip to Ross. Work your magic.
Hi, Flor. How are you?
Hi, I'm here.
I'm excited. Thank you for coming on. I feel like vaccinations are a really hot topic, as we talked a little bit about before we started recording. So I'm excited just to drop into the science, dig into your knowledge, and just thank you for sharing.
Absolutely. My pleasure.
So let's start with, why don't you tell me a little bit about yourself and what led you to vaccine safety in the pregnant population in pediatrics?
So I am a pediatric infectious diseases specialist, and I was fortunate enough to be training at a center in academia where people had been working on maternal vaccines for a long time. I'm going back to the 1970s and 1980s. So by the time I started working with this group in the late 90s, there had been already quite a bit of progress made at that time related to research in vaccines for influenza, for group B strep disease, which is a bacteria, and other respiratory infections that are prevented through vaccination, specifically that cause pneumonia in adults and also in babies. And so I started working on this topic, influenced by amazing mentors. And certainly in the last 30 years almost since I started working on this topic, I really became really fascinated by maternal vaccines. As a pediatrician, I think that it's very important to have a mom who is very healthy during her pregnancy, so that her pregnancy is a good one. She has healthy pregnancy and that she has a healthy baby. And this is very critical, certainly everywhere in the world, not just in the United States. So the area of maternal vaccines is expanding now to include new vaccines, but also to ensure overall that vaccination is one piece of the antenatal care that needs to be optimized for women all over the world.
That is really helpful. So I know that there's some confusion about vaccines in early pregnancy. So for parents who are early in their pregnancy and just starting to hear about recommended vaccines, can you walk us through which vaccines are currently recommended during pregnancy? And also, because I'm always about the why, the reason why behind them.
Yes. So I'll start with one of the oldest vaccines that became recommended in pregnancy. That is actually the tetanus vaccine. This is mainly to prevent neonatal tetanus. And although we don't see that much in the United States because we have deliveries at the hospital, and this is more of a problem when you have at-home deliveries or deliveries that are not sanitary. Certainly the addition of the pertussis vaccine. So we have a combination vaccine that includes tetanus, diphtheria, and pertussis that is recommended for pregnant women since 2012. And as such, it really gears towards preventing both tetanus disease, but also whooping cough or pertussis in the babies. This is mostly a prevention for the baby, as mothers don't usually have significant complications from whooping cough. The second one that relates to directly protecting the baby is actually the most recent vaccine that was licensed and approved in the United States in 2023, which is a maternal vaccine for respiratory syncytial virus, or RSV. This is a virus that causes bronchiolitis and pneumonia in infants. We don't have a vaccine for babies, and we don't have a good treatment for babies against RSV. Yet they can be very sick in the first few weeks of life. This is typically a disease of babies that are otherwise healthy, so they don't have to have any other underlying problems and or being premature, although premature babies and those with congenital heart disease tend to have more problems. All babies are affected by RSV, and therefore this vaccine was designed and engineered precisely to give in pregnancy to fill that gap and protect babies against bronchiolitis caused by RSV and pneumonia. And then I'll go with the other two that are recommended. These have in common that they were recommended initially for protection of the mother, but they both also have been proven to protect the infants against disease. And these are the flu vaccine, influenza. We've been using it in the United States for pregnant women since the 1960s because we recognize that pregnancy is a condition where you could have more severe disease and complications from flu in the third trimester of gestation. And later on, studies demonstrated that not only you protect the mother, but you can also prevent severe disease in the baby in the first few months of life. And for COVID-19, similarly, during the COVID pandemic, pregnant women were included very early in the rollout of the vaccines because they also had complications in the third trimester from COVID disease. And again, we have shown that babies do benefit from maternal vaccination and they can be protected from severe disease. Of note, we don't have a vaccine for infants until they're 6 months of age for both flu and COVID-19. So this maternal protection through the vaccine in the mother actually is all they have to get through the respiratory season when there's flu and COVID circulating.
So I want to go deeper into that, but I do have a question. So kind of backing up to one of the first ones you said was, I think, tetanus. And you were saying in a hospital setting, but not a home birth. So I know that, home birth's not huge in the United States, but it is something that people do. And definitely outside the States, it's higher. And sometimes and I've had a few students have this situation, births on the way to the hospital or precipitous births. So what's the situation there? Because it's not that it's necessarily unsanitary. It's just a different type of setting. So I just want to kind of back up to make sure I understand what you were mentioning about the tetanus.
Of course, yes. And actually, you're right. It's not necessarily unsanitary, but it is it is a delivery in a situation where you might have contamination from tetanus spores. So tetanus is a bacteria, and it actually lives in the environment. More commonly, we know about tetanus from being in dirt or dust, so typically we worry about tetanus and we want to get vaccinated when we've had a cut or any injury with something that is out in a field or a nail, step on a nail.
Sharp, rusty,
yes,
something.
Sharp, rusty, but, basically things that are exposed to the environment and things that are exposed to dirt or, just unclean surfaces could be a concern. So if you have a precipitous delivery in a car, or if you are, in a place that is not a usual hospital setting, there is a possibility that you could have contamination, but much less so if you have a birth at home where you have everything controlled and clean and able to prevent this contamination. But the other aspect is also that even if maybe I'll just say the other aspect is that it's very difficult to prevent tetanus once it happens. So if the contamination, which happens in other countries in situations where home births are in places that are potentially contaminated, it's by cutting the cord or by having contact, with dirty hands or hands that are not properly sanitized at the time of delivery, and this infection sets in very quickly, so that tetanus usually shows in the first few weeks of life, and it can be deadly in the majority of babies, unfortunately, that get it. Moms can get infected too, so it's important to protect both the mother and the baby. And in most parts of the world, if a woman is not completely vaccinated or her vaccine status is unknown for tetanus, it's actually recommended that they receive 2 doses of a tetanus-containing vaccine during pregnancy to precisely prevent any circumstance of infection of the mother or the baby at the time of delivery.
That is actually really fascinating to me because I know there's been controversies about measles and the COVID and the flu shot. It never occurred to me that tetanus, I guess if one tends to lean away from vaccines, that would be on the list, but it never even occurred to me that tetanus, it's one of those things I feel like we just get every several years and it's just, but yeah, it hadn't occurred to me.
It's a consequence of having a vaccine that works and having children who receive their tetanus vaccine as part of their routine vaccination in this country. And so if you have a baby that is fully vaccinated, they've received usually up to 5 doses of tetanus vaccine by the time they go to school, to elementary school. And then we give them a booster as teenagers. And so most women are protected already because they've been vaccinated routinely. And we only see tetanus usually in the U.S. in older people because this is that one vaccine that is recommended to get every 10 years. Most people don't remember that. And so unless you have an injury, a cut, where actually they will ask you for your tetanus vaccine status and then give you the vaccine if you haven't had it. The only other opportunity is in pregnancy because it's part of the Tdap vaccine. So we do see tetanus in this country, but mostly in older people who have lost their immunity because they didn't get their every 10-year booster.
Oh, that's interesting. I just got mine about a few months ago. I remember it really hurt my shoulder. All right, we'll move on though. So how does the maternal vaccination protect the newborn in those early weeks? I'm guessing it's about the antibodies because they can't receive their own vaccines at that point.
It's completely based on antibodies. And this is the part that is fascinating about pregnancy and about this amazing organ, which is the placenta. So pregnancy is all about tolerating the fetus and ensuring the health of that fetus to grow into a full-term infant and ensuring the survival of that infant. And the placenta is just, again, an incredible organ because it actually has what we call a receptor. So in its cells on the maternal side, this receptor is going to capture the antibody from the mother, specifically the IgG type of immunoglobulin G of antibody, and actively transfer it to the infant blood circulation so that this is basically a pump. It's an active transport. It's trying to get as much of that antibody on the baby side. And it's selective because it's going to pick this one particular antibody called IgG, which is made after anything that the mother has been exposed to, either an infection or a vaccination in the past. And so any antibody amount that is present on the mother's side is going to go to the baby. And this process usually begins in the middle of the second trimester. As the placenta size grows and the number of receptors increase, the amount of antibody that is transferred is actually going to also increase in an exponential manner, so that at the end of a pregnancy, the baby side is going to have actually higher titers, so more antibody than the maternal side. This is that pump. This is that survival need and the ability that this pregnancy and placenta system have to ensure that that baby is going to have as high levels of antibody as possible at birth, because they will need that for at least the first 6 months of life. As the baby's own immune system is able to adapt and respond to either their vaccines or other infections and make their own antibodies. The baby's immune system is such that it does require some adaptation to responding to different stimuli, and they will not be able to respond to some viruses or some bacteria very well in the first few months of life. So if they didn't have that maternal antibody, they would really be at risk of not being able to handle these viruses and bacteria. And this is why we see significant impact from infectious diseases in the first few months of life, especially the neonatal period, the first 4 weeks of life, where babies can be at risk of infections with even bacteria that are commonly part of the flora of, the vaginal canal or the mother, or viruses that usually don't make their older siblings, or other parents or other people around them very sick. But babies can get very sick from these infections because they're still not able to handle these very well. So you see how the maternal antibody and the process by which these babies obtain it is really ensuring their survival and the health of these babies in the first few months of life until they can do it themselves through, again, a process of their immune system growing and adapting, but also through their own immunizations.
So if I'm understanding what you're saying, as long as the pregnant person has their vaccinations, the antibodies are incredibly present and prevalent in the newborn. So I've heard some parents concerned like, I shouldn't take my baby out until their first round of vaccines, because if the parent had them, the baby's pretty protected. Am I understanding that? So I'm just trying to take some anxiety away from parents that are like, I want to go out, but my baby's not vaccinated yet.
Yes. Well, it is prudent. It is prudent to protect the babies, especially in the first 4 to 6 weeks of life, to not be exposed to too many people. And I'll tell you why. So yes, ideally, if the mother herself is healthy and the baby is term and the mother has been vaccinated with all her vaccines, then yes, she will be protecting her baby. Also, remember, there's breastfeeding. I'll add that too, because if the baby is nursing, you're getting additional protection through the breast milk that protects the respiratory tract, the GI tract, so you don't get as much respiratory disease or diarrhea illness. But again, even with that, if a baby is infected and has a high fever in those first 4 to 6 weeks of life, it's very difficult for the pediatrician and other healthcare clinicians to really understand how well this baby is going to handle the infection. So we tend to be very, very careful, very conservative with babies. Anytime there is a fever, the baby is probably going to need a full evaluation. So they will need to come to the hospital and get some blood work, sometimes get additional work, and even be admitted to the hospital until one understands how they're doing and what type of infection they have. So this is why I think it is prudent, and I would definitely recommend moms to be very careful in the first few weeks until, the babies are able to grow a little bit out of that period, and to start their vaccines. Usually we start at 2 months, as they normally are recommended, because that's when, again, they're going to start building up their own immunity. But yes, if you are vaccinated as a mother, you already are giving this amazing gift to the baby to even reduce further any risk that they have from any exposures they could have after birth.
Oh gosh, I remember the fever situation. My son was having a really bad fever, and my daughter at that point was like 3 weeks old. And so we had to keep them in separate rooms. We went so far as every time we went into the room the baby was in, we changed our clothes. And then we went back so that we couldn't possibly cross-contaminate, because I remember hearing that if the baby gets a fever, it's a really, really big deal. So I appreciate you sharing that.
That's exactly right. Yes. And we want to prevent that. And yes, we do everything we can during our pregnancy, right? We eat healthy, we exercise, we sleep, we make sure that we are not exposed to other illnesses, and we get vaccinated to make sure that we avoid any of those, bad moments once the baby's here.
All right, we're going to take a quick break, but I do have kind of a hot question because I know that some parents are nervous about the safety of vaccination. So we're going to come back and open that can of worms. So we will be right back. Okay, we're back. So what would you say to parents that ask, are these vaccines really safe during pregnancy? How would you respond to that?
I would say yes. And the reason I can give you that answer is because we have a lot of evidence that supports that the vaccines that are currently recommended in pregnancy are safe for the mother and for the baby. I know this is the first question we are asked as clinicians when we even consider discussing vaccines with a pregnant woman. Is it safe? Is it safe for me? Is it safe especially for my baby? That's all they want to know. And the evidence that we have really comes, as I was telling you, from lots of decades of utilization of the vaccines. We have information, and millions of doses given in pregnancy for all of them, for influenza, for COVID-19, because we've been recommending them for the protection of the mother. Yet we have what we call observational studies and also controlled studies where the vaccine is given in pregnancy to some women and not to others, or there's another comparator. But consistently, both of these vaccines have actually been able to not just be safe in the sense that they don't hurt the pregnancy or the infant, but actually shown to be protective against some outcomes of pregnancy that the infections themselves can cause. So, for example, COVID and flu in pregnancy, as I was telling you, could result in pneumonia and complications in the third trimester, which end up causing, for example, preterm birth, or babies that are born with low birth weight, or other complications due to maternal fever. And consistently, many studies and also reviews of the data through years of utilization have shown that the odds of people having these negative pregnancy outcomes is actually lower if moms are vaccinated compared to those who were not vaccinated. For the Tdap vaccine, as I mentioned, it's been recommended since 2012. So we have now almost 15 years worth of data. This is a vaccine that is used all over the world. And now I would say it's even more important to use it because we're having pertussis and whooping cough outbreaks everywhere, especially in the US. But a significant number of studies, actually, these vaccines have, just like flu vaccine, they have a specific indication in their package insert so that physicians can see what data is available about the safety. And they have been shown also to be safe. And lastly, the RSV vaccine, although it is the newest vaccine that we have, this vaccine actually went through specific clinical trials during pregnancy, where thousands of women also throughout the world received the vaccine compared to a group that did not receive the vaccine. And for this one, there was an initial concern for a different vaccine that was actually not licensed. So that's not one we are using right now, where there was a signal of more preterm birth. So actually babies were being born early in the vaccinated group versus those who did not receive the vaccine. And that was not the case for the vaccine we have right now. But there was enough concern when the vaccine was recommended to actually give it a little bit later in the pregnancy. So it's currently recommended between 32 and 36 weeks of gestation. And we have been using it since 2023. And all the data so far of surveillance of whether babies are born earlier or not if the moms are vaccinated are showing that that is not the case. So there's no more prematurity when a mom receives the the RSV vaccine compared to when a mom does not receive it. And the data is now consistent in the US and other countries that are using the vaccine, including UK and Argentina, for example. So in general, the benefit that these vaccines can have for both the mother and the infant surpasses any potential risk. And the data that we have regarding how safe these vaccines are is very, very positive and supporting the safety of the vaccines.
Oh, that is great. All right. I have a two-part question for you. So families may encounter conflicting information online. So the first part is, how can they evaluate the source of information and know it's trustworthy? So maybe we can show or offer some, and then I can put that in our show notes. And then what are some of the most common misconceptions that you hear about vaccinations?
Okay. So yes, very concerning to know that there are so many influences out there that cast concerns and doubts on people's mind regarding vaccines. This is not specific to vaccines and pregnancy. Unfortunately, it seems to be a problem with all vaccines right now. And this is why I agree. This is the time when it's even more important to make sure that you know where the information is coming from and that you go to reliable sources of information. And there will be a lot out there. It can be overwhelming. But we know that we have very strong professional societies in the United States that give you not just the recommendation, but a lot of the evidence that is supporting the recommendation, in addition to resources to understand a little bit more any potential concerns that people could have. So I would point out specifically to the American Academy of Pediatrics and the American College of Obstetrics and Gynecology. Both have websites that have, again, not just the very specific guidance on how to use the vaccines, but also information for providers, information for the public. And I would say that definitely the most reliable source of information you can find right now. More recently, because of these concerns, there has been an initiative called the Vaccine Integrity Project. This is out of University of Minnesota that have been precisely trying to address some of these concerns. And they have looked at some of these vaccines, especially vaccines in pregnancy. And there are publications, but there's also a website from the Vaccine Integrity Project that will give you for each group. So pregnant women is one group, but they'll also talk about vaccines in children, and they'll talk about vaccines in adults and older adults as well, and provide you with the recommendation and links to the evidence that has generated these recommendations with what we call meta-analysis. So they've looked at the question of safety, and they've looked at the question of how effective the vaccine is in preventing the diseases that they're meant to prevent. And this is a report that just came out last year, where you can see with a lot of detail how, again, the risks are very minimal, if any, and overall the vaccines are considered safe and effective because of those analyses that include multiple studies that have been published. So those would be, I guess, 3 sources of information that I would recommend. I think that some of the main concerns that I hear specifically regarding vaccines and pregnancy are based on the fact that sometimes moms are not aware of the impact of the diseases, or they might not have a strong recommendation from their doctors that they need this vaccine, and not realize that what could be the impact of the diseases if they're not vaccinated. So concerns relating safety, as we mentioned before, maybe thinking that, oh, I never get the flu, so why should I get the flu vaccine? Or, I my baby is not going to be exposed to other children because they're going to stay home, so they don't need the vaccine. I don't need to get the vaccine for them either. And not understanding, again, that this is something that all babies are susceptible. It's a particularly vulnerable period in life, the first few months of life, when they need that immunity from their mother. And what we're doing with the vaccine is basically boosting this immunization. This immunization is going to boost, so increase the antibody titers. All women who are of childbearing age, they have either already been vaccinated with one of these vaccines or they've had the infection. So all of us have had RSV. We usually have RSV before we're 2 years old, and we get recurrent infections through life, except we don't get very sick. So in pregnancy, we're just getting a booster for that. Whooping cough, same thing. We all have been vaccinated, but we're just trying to increase those levels for the baby to be protected. And flu and COVID, even more. All of us have had it at some point or have been vaccinated. So we're just boosting. So this is why these are not new vaccines necessarily for pregnant women. These are boosters that were given with the purpose of improving the chances that there's going to be enough immunity to protect both the mother and the baby.
So what would you say someone that feels anxious about too many vaccines for a newborn or overwhelming the immune system? Because I remember getting a list of all the vaccinations and I was like, that's a lot. And then my pediatrician and I just talked everything through, which I really appreciated. She spent time explaining it. But it could feel overwhelming when you hear how much a newborn's getting. So how would you respond to that?
Right. So I hear that a lot as well. And I have to say, first, there's really no overwhelming of the immune system because babies are exposed to a whole lot more just from being at home and in their community. All the environment has a lot of antigens, so things that they get exposed to that their immune system has to recognize and deal with, and babies are programmed to do that. So our immune system actually starts developing before birth and continues to evolve over time to adapt to all of these exposures and stimuli that they have. So I think that what I would say about this concern is that we understand enough the immune system of the baby to know that they will be more susceptible to getting infections as their ability to handle a virus or a bacteria is more limited at this age. However, a vaccine, all it does is try to mimic is such an infection and does it in a safe way, in a dosed amount that is sufficient just to stimulate their immune system and not make them sick. So it's almost like training the baby's immune system so that they can then know how to respond to these bacteria and viruses in the environment and not get sick, but develop their own protection. The vaccines that we use now, including the vaccines that young infants have to receive, are very safe and much pure vaccines that we had when I was growing up, the ones that I received, that many of us, that the mothers received, So, for example, the vaccine that we received before 1995 that was for whooping cough and tetanus and diphtheria. That's the DTP that children receive. Used to be made with, basically a full bacteria for pertussis, and this carried a lot of antigens. So a lot of components of the bacteria were in there. So those vaccines used to have, they would say, over 3,000 components in it that, the baby's immune system had to be exposed. And this is a vaccine, by the way, it still is given in many parts of the world because the more that the immune system can see, the more robust the immune response is going to be. So it's still used. The problem is that this vaccine used to have a lot of reactions, so maybe more fever and more malaise, and the babies did not handle it very well. So we went to a different type of vaccine that basically reduced significantly the number of antigens in it. And now, so without that one, that was the one that had the most. Even if we give more vaccines, they're combined, they're purified, and the number of antigens is only a fraction of what we used to have. So very, very reduced. I want to say, about 100 or so, not thousands of antigens in it. And vaccines that have been specifically tested so that given together or in combination, so say one shot with multiple types of vaccines in it, then they're able to do their job. So it stimulate their immune system and at the same time minimize any side effects that they could have. And the most important point that I would like to make, get across is that we need to give these vaccines when you need them the most. So the highest risk for the babies is those first few months of life when they get exposed and their immune system is still trying to learn how to handle these infections. If you don't give the vaccine and train their immune system to be protected, but rather wait until they're older or just not give the vaccine at all, they are not going to be prepared to handle the actual infection, the virus, the bacteria, and they could still be very susceptible to those diseases. So waiting defeats the purpose because you want to have the protection as early as possible after birth, and we can start vaccinating at 2 months because that's when we start seeing a response. But it's because they need that protection then, and we should not delay, getting that protection.
So I'm going to open up to another maybe controversial topic. So the reason I actually wanted to speak today is because, I don't know, was it a month ago, 2 months ago, there was a whole new discussion of the vaccines that were recommended. So I thought we should talk about that. So as I mentioned, there's a lot of conversation about changes in the pediatric vaccination guidance. And some parents are hearing that different organizations may not be fully aligned. So can you break down, I guess, understanding these updates and how should parents approach this decision-making with their pediatrician?
Yes, we are living unfortunate times. And I say that because, unfortunately, parents and children and patients in general are unfortunately victims of this misinformation and these changes. One positive aspect of the pediatric vaccine schedule is that it is something that has been developed mainly through professional organizations like the American Academy of Pediatrics for over 30 years. And just to put things into context, we had been fortunate in the United States by having a central system or mechanism by which there could be a harmonization of the guidance for vaccines. And specifically for pediatrics, that meant that the American Academy of Pediatrics would harmonize with the Centers for Disease Control, so the Advisory Committee of Immunization Practice, work together on developing the immunization schedule to make sure that there was no concern, that there was no inconsistency. So what we have seen now is that there's been a unilateral decision made by the CDC and ACIP based on recommendations from the health department to change the immunization schedule without participation from the professional societies or from experts in the field. And honestly, without evidence to indicate why these changes have been made. The changes include removal of some vaccines. They include removal of the specific recommendation by making them quote unquote shared decision making, which is something that always happens anyway with all recommended vaccines, and by changing some specific timing of administration of some of the vaccines. And because these changes are not based on evidence to support them, actually they ignore evidence against the changes. the American Academy of Pediatrics has been very clear about the position to continue to use the immunization schedule that they have now published in 2 years in a row, 2025 and 2026. That basically is unchanged from what we had been doing before, because all of the vaccines recommended there are well supported and have a very specific role in the immunization schedule. The current American Academy of Pediatrics immunization schedule is not just from the AAP. It's actually endorsed by at least 12 different professional societies, and in addition to that, by immunization experts, and is publicly available, and more societies and other groups are joining to adhere to the American Academy of Pediatrics guidance. I'll say that for maternal vaccines, the same is true in terms of the American College of Obstetrics and Gynecology and American Academy of Pediatrics, since, it's about the mom and the baby. They're together, aligned in this having the recommendations for maternal vaccines and infant vaccines in the same way. So I think that there is no misalignment actually in the recommendations that we have from the professional societies right now. They're very clear. They're very well supported. They are available. And it is really the responsibility of vaccinators to try to continue to utilize these recommendations at this point. So I'll stay there. I don't know if you know.
That's good. That's good. I appreciate that.
Mm-hmm.
And again, I'll make sure in our show notes we have the ACOG, the American Academy of Pediatrics, all that. I'll make sure we have the link so people can look that up. So if you could leave families with one grounded, evidence-based takeaway about vaccinations during pregnancy and infancy, what would it be?
So vaccines work, and especially vaccines in pregnancy have demonstrated to really save lives. They save the lives of the mothers, who can become very sick with some of these infections, specifically respiratory infections, and they save the lives of the infants. And this is something that is objective. We have measured this. We have sufficient data. Reduction, for example, of pertussis mortality is 95% if a mother is vaccinated. So we are trying to prevent the most severe consequences. And we have the data to support the fact that babies of mothers who are vaccinated against any of these diseases have substantial reduction in death, but also in severe disease, and that results in much less severe complications. The maternal vaccine, in addition to the direct protection that the babies can get through the antibody that comes in the blood through the placenta, also has an added benefit or bonus, which is if moms are also breastfeeding, they will have additional protection for their babies. And this is something that we forget sometimes, but it is a dual protection. I call it a systemic because it goes through the blood, and a mucosal because the breast milk coats the baby's respiratory tract and GI tract and protects them against disease. So we have again sufficient evidence to show that all of these have been highly effective vaccines, and that we can save babies' lives and reduce severe disease if moms are vaccinated.
That is helpful. Okay, we're going to take a quick break. And when we come back, what is one final tip or piece of advice you'd like to offer new and expectant parents? And it doesn't have to be vaccination-based. It can be anything that you want to share. All right, we will be right back.
Ready to soundtrack your summer? With Red Bull Summer All Day Play, you choose a playlist that fits your summer vibe the best. Are you a festival fanatic, a deep end DJ, a road dog, or a trail mixer? Just add a song to your chosen playlist and put your summer on track. Red Bull Summer All Day Play. Red Bull gives you wings. Visit redbull.com/brightsummer ahead to learn more. See you this summer.
Okay, we are back. So what is one final tip or piece of advice you'd like to offer new and expectant parents?
So, as a new and expecting parent, you have a lot of questions and you have a big responsibility. I think that a new mother and new father are going to really want to do everything that they can to have a healthy baby. And there is no better time to really reach out to get information from trusted sources about how to make sure that moms are healthy, their pregnancy is healthy, and the babies are healthy. So you can't afford to make mistakes when you have such a great opportunity. And the beauty of becoming a parent and enjoying an infant, a baby who is a miracle. Every baby that is born is really a joy for every family. So I would advise them to really keep that in mind, that just like them, their doctors, their obstetricians, their pediatricians are going to have the best interest of their baby in mind as well, and of the mother. And so please talk to them. Please make sure you look for the right information, and that we work together, both clinicians and parents, to make sure that we have a good outcome. It's such a precious time that we want it to be the best experience for everybody possible. And something, as simple as a vaccine can make a tremendous difference in both the mother and that baby's life.
Thank you. And where can people find your work?
It seems that I've been doing this work on maternal vaccines and infant infections for a very long time. I am a member of the ACOG, American College of Obstetrics and Gynecology Immunization Group. I am very active with the American Academy of Pediatrics. You can find information regarding what I do by looking for publications regarding maternal vaccines, because I've done several of the studies that have also supported this recommendation. And I think, did you want to have a specific link or something?
Whatever you'd like to share, just if people I want to learn more from this person, where can I find her?
Yeah.
That was what I was thinking.
Well, okay. So yeah, maybe if you can edit this part out, but yeah, I have to say I'm a pretty active investigator, but also clinician in the field of maternal and infant vaccination. And I think you'll be able to find my work along with that of many of my colleagues through publications in the medical journals, but also through pieces that we have been able to put out in the media, and also through the professional societies that we do in collaboration with both providers of maternal health and also pediatric health, to really inform parents about these diseases, and also the availability of vaccines and what they do. So many sources out there, and I would say, just like me, there are many other individuals that you can find in academia and the clinical world that can support the vaccines in pregnancy and answer your questions.
Thank you so much. You gave such great information, and I love when we can point to data and evidence-based information, because I think it can help people make informed choices. So thank you for what you do. Thank you for your time.
Thank you so much. Really appreciate it.
This has been an episode of Yoga Birth Babies, produced by Prenatal Yoga Center. You can catch us on Facebook, Twitter, Instagram, and Periscope. I'm Deb Flaschenberg. Thanks for listening.